So Steve, we have a little ultrasound medium on your foot, and then I'm going to pick up your Doppler pulse. There it is. You hear that? And then we're going to listen to where it goes away. And it should be all right. Well, that's great, Steve. What I can tell roughly from comparing the blood pressure of your lower leg and your arm and their ratio is there's no indication you have peripheral vascular disease at all in your lower extremities. So that's good news. So I'm going to check the pulses of your feet and make sure they're the same. I feel them the same on both sides. I'm feeling the pulse in the top of your foot. It's called your dorsalis pedis. And then I'm going to feel the pulses inside, just inside your ankle here. And that's called the posterior tibial. And you know, you have good pulses in your posterior tibial. You know, 15% of the people in your age group don't have those pulses. I'm going to do one other thing. Remember the oxygen saturation meter that we use all the time? I'm going to put it on your second toe. And I'm going to check to see if, once it picks up your pulse, I'm going to check to see if your oxygen saturation changes when I raise your leg. So it's at 97 now, and I'm going to raise your leg about 16 inches and see if it goes down after 15 seconds. And it did not. The reason I do that is it's kind of a very quick test to tell if you have any issues with your blood vessels in your legs. And because you've had some heart disease and you had a procedure, it's always good to check the vessels that are in arteries farthest from your heart. And there's no indication there's a problem. Steve, what I'm going to do now is I'm going to first listen to your carotid pulse in your neck. Then I'm going to listen to it, palpate it, and palpate your radial artery in your wrist and see if the pulses happen about the same time. So I'm going to have you first turn your head slightly that way. Perfect. You're going to feel me touch my stethoscope, the bell of my stethoscope, right along where your carotid artery is. And what I'm doing there is I'm making sure that I don't hear a bruit. That would mean that there is some narrowing, okay? And I don't hear any. Then what I'm going to do is I'm going to just feel your carotid. And then I'm going to feel the carotid pulse, which I'm going to tap. That's how your pulse is. And I'm going to make sure that the pulse in your radial artery feels about the same, so it's transmitting the same. And they are exactly in sync. So what that lets me know is there no obstruction of flow from your heart that goes to your carotid, and then your heart that goes down your subclavian artery down into your arm. So that's normal. Could you go ahead and turn your head toward me and stick your tongue, open your mouth and stick your tongue out for me? There you go. All right, very good. What I'm looking for there, do you ever have any bleeding when you floss or brush your teeth? Okay. You know, it's really interesting because you've had some artery issues in your heart. We now know that when they take plaque out of someone's carotid or out of plaque out of somebody's artery, and they analyze it for the bacteria in the mouth, that 70% of people with plaque in their arteries have abnormal bacteria in their mouth, and they can find that same bacteria from their mouth and their arteries. So when somebody's had a long history, it's as important to have a healthy mouth and make sure you floss and brush. And you obviously do. You don't have any signs of gingivitis or really any abnormal plaquing in your mouth. So good job. So Steve, we're going to check your blood pressure lying flat, and then I'm going to have you stand up. So what am I looking for here? I'm going to be checking your blood pressure and your pulse when you're lying flat and see if when you stand up, your blood pressure drops 20 points or your pulse goes up 20 points, okay? So I'm going to first check your blood pressure here, laying flat. Right. I'm going to check your pulse here. All right. So you're right at 60. So what I'm going to have you do is I'm going to have you swing your legs around and stand up for me. Stand on the floor. Check this blood pressure here. You can just let your arm just hang. Try to do this within 2 minutes of when you stand up. And what we're really interested, are you feeling dizzy at all or lightheaded? Great. Okay, I feel your pulse here. Perfect. So your blood pressure didn't drop 20 points and your pulse didn't go up 20 beats per minute. So there's no sign that you are low in fluids or your blood pressures, your medications have an adverse effect for you.